9 years ago, Dr. Luke Van Kirk started Command Family Medicine. We've been one of the leading direct primary care clinics in the Southwest Missouri area. It started because early on in Dr. Luke's career, he found that in the traditional primary care setting that patients didn't have the access to care that they needed. It was taking forever for them to get in for established care appointments. By the time that they did, appointments were really hurried and rushed. And on top of that, there's no transparency to the pricing of primary care services, and insurance ended up being more of a headache than anything for both the patient and the provider. So we started Command after the direct primary care model, which is that monthly membership-based model of primary care. And today I'll provide you with a brief overview of Command Family Medicine, the services we provide our patients, as well as answer some frequently asked questions from a patient survey we sent out recently. And at the end, I'll touch on some special services that we provide that I want to make sure that you guys know about, especially if you're already a patient at Command. So there are three things that set Command apart from a traditional primary care clinic. The first thing is access. All of our patients can reach out to their provider directly via text message, email, or phone call. This really makes it easy to get quick answers and to get that help that you need when you need it, instead of waiting for days or weeks to finally see your provider to get an answer. Along with the direct access, we also do same and next business day appointments for time-sensitive needs like injuries or illnesses that need hands-on evaluation. And in order to get in for an established care appointment, it usually only requires about a week or two to find a slot in the provider's schedule. So access at Command is very, very high. The second thing that sets us apart from the traditional primary care clinics is a wholesale model built into everything that we do. So labs are done at wholesale cost, typically about 10 to 20% of the commercial price. For instance, annual labs are under $20 cash. We also do wholesale prescriptions through our partner Lawrence Drug. They provide wholesale prescriptions and supplements for our patients. And then also we do wholesale procedures. So you cut your finger, you come in and get stitched up at Command. We only charge you for the supplies that we use, or about $20, because you're already a patient at Command. So why should you have to pay a huge procedure fee if you're already a patient and you're paying monthly membership? The third thing that sets us apart is patient autonomy. We are big advocates for our patients that medical decisions are up to them. They're not up to us. As primary care providers, we're there to help kind of coach, counsel, provide education to see what we think makes the most sense for you. But your medical decisions are 100% up to you. We're not here to box you into a corner and tell you that you have to do things a certain way. So Command is a very friendly place to come and ask questions and to see what direction you should potentially take for your medical care. Now we're going to get into some frequently asked questions. We're going to start with, can I use my insurance at Command? Well, Command is a monthly membership, cash-based clinic, and so we don't actually bill insurance directly for literally anything. Your monthly membership covers all of your communication with your provider. It covers all of your visits. There's no copays, and if you want to, you can use your HSA account to cover your monthly membership and any other fees that you might acquire at Command, such as your lab work or a procedure if we do an in-house procedure for you. We also got a question about vaccines. Why don't we carry more vaccines than we do in the clinic? The reason is they're very expensive, and there are other places to get vaccinations, such as pharmacies or the county health department. Annual physicals. Yes, we provide annual physicals. We do established care visits, annual physicals, well child checks, well woman checks. We troubleshoot injuries and illnesses like any other primary care would, but with better access and no copays. Can you all get an InBody scan? InBody Scan, body composition scan, is available at Supplement Superstore generally for free at any one of their locations in the Springfield area. This is a great tool to use to track your weight loss journey, or if you're trying to pack on some muscle mass, it measures your skeletal muscle mass, your body fat percentage, water weight, all kinds of stuff, and it tracks it over time. So instead of buying one of these really expensive machines, we can just point you in the direction where you can generally get it for free. InHouse Counseling. We would love to have an in-house counselor or therapist. We just haven't found anyone who would be a great fit for us at Command, but we're keeping our eyes peeled because we agree that would be an awesome thing to have in-house for our patients. What about Xrays and broken bones? So we do in-house Xrays for $50 for our patients, $100 for people who are not a patient at Command. And we can also treat basic fractures. Occasionally we'll have a fracture that we need to send out to an orthopedic clinic or prescribe special splint for, but we can handle a lot of those things in-house. What about getting CT scans or MRIs? So we can get CT scans done, cash price for about $500. We partner with multiple imaging businesses in the area to get MRIs, CTs, and ultrasounds done. We can get, for instance, like a brain MRI without contrast for $350. We can get an ultrasound for $240 to $250, and CT start at $500. So we can get non-emergent advanced imaging done for a very affordable cash price. A lot of these things, if we were to try to use insurance and go through one of the big box options, one of the big hospitals, even if you use insurance, a lot of times you're paying more money out of pocket at the end of the day. What about weight loss? So weight loss definitely falls under the category of primary care. We can provide education and counseling on weight loss. We can also prescribe the GLP-1 receptor agonist medications like Ozempic and Zepbound, the generic forms of those. We use a compounding pharmacy right now to get them at a very reduced price for our patients. So, the commercial price for the GLP-1s is $1,000 plus per month, and we can get the Ozempic generic for about $100 to $150 a month right now, and the Zepbound generic we can get for around $200 to $300 per month, and potentially even lower in the future as we are exploring additional compounding pharmacy options. What about video visits with your primary care provider? So all of our providers are able to do video conferences with our patients. It's a convenient way to talk to your primary care provider if you want the experience of a video call instead of just talking over the phone or coming in. And it's also helpful if there's an illness or injury that might benefit from a quick kind of eyes on and may not be worth a trip all the way to the clinic for. And so if you think that that might be helpful for you, talk to your command provider to see if they can hop on a video call with you. Now I'm going to go over a few additional features that even if you're a patient at command, you may not be aware that we provide some of these things. So a few things. The first is male testosterone replacement therapy. We do a lot of TRT at command. Lots of great benefits for our male patients with low testosterone. So talk to your provider if you think that that may apply to you. We also do regenerative medicine injections like platelet-rich plasma for $250, which is very inexpensive, and prelotherapy for $50. And these are regenerative medicine techniques that can treat osteoarthritis, shoulder issues like rotator cuff, tendon problems, a bad knee like a meniscus problem or a ligament problem in your knee, even things like tennis elbow or plantar fasciitis in your heel. So lots of things we can treat with these regenerative medicine injections. We see a lot of improvement in our patients with these injections, and we have the cheapest prices around. We have a laser machine that we use to do laser hair removal as well as treat certain skin conditions like cherry angiomas, rosacea, acne scars, a number of basically dermatologic conditions. So if you want more information about that, call our clinic and we'll get some for you. We can get a multi-cancer screening done called Gallery by Grail. If you look at the cancers that cause the most deaths in the US, the Gallery test is set over 70% sensitive at picking up 2/3 of those cancers. So it's a very sensitive, very effective test for testing for those really bad cancers. And many cancers we don't have very good screening tools for. So especially if you have a significant family history of different types of cancer, the Gallery test by Grail may make sense for you. So make sure you talk to your command provider if you think that you might benefit from that. As far as cardiovascular screening goes, we like to utilize the advanced cholesterol panels, which most primary care providers are not using these days. Typically, you just get a basic lipid panel, which is a very general overview of your cholesterol health, but it's missing a lot of really important markers that can help us understand better what your risk for developing plaque in your arteries is, and it can help make sure that you're not on medication that you don't really have to be on. Lastly, we have different ways of detecting plaques in the arteries. We can get a coronary calcium score done, which looks at hard plaques in the coronary arteries. We can get an ultrasound of the carotid in such a way that it looks at plaque development in the arteries and gives us a good idea of what could be going on with your coronary arteries. It's a very non-invasive way to get kind of a general impression. And then one of the very best screening tools for plaque in the heart arteries is a CT angiogram of the heart and arteries with contrast with post-editing by a company called Clearly. What they do is they do a contrast-infused CT scan of the heart, and those images on a disc get sent to this company, they're able to map out the results in such a way that we can see in fine detail how much plaque you have in which arteries of your heart, and whether they are the low risk plaques, the hard plaques that generally don't break off and cause fatal heart attacks, or whether you have a significant amount of soft plaques which are unstable and can turn into those big MIs, those scary and often fatal heart attacks. So if you think you might benefit from an advanced cholesterol panel or even a CTA of the heart and arteries, make sure you talk to your command provider and we'll give you more information and kind of talk about that process. So that's the conclusion of this newsletter for January 2025. We wanted to make sure that you guys had a video to share with your friends or family that might be interested either in command family medicine or in another direct primary care clinic, because we really think that it's the future, that it's the best way to get the care that you need when you need it, with the kind of flexibility that a lot of people are looking for and with a lot of cost savings built in. And so if you'd like more information, go to www.command.md or give our office a call and we'll make sure to get you guys set up. Thank you guys so much for watching, and we'll catch you in next month's video.